Welcome to Eminence Unfiltered Part 7. 17. Welcome to Eminence Unfiltered Part 17. Today we have a very special guest with us, but let me just first of all set the stage and tell you, we always talk about the medicines, we always talk about the pharmaceutical. I think it is very high time that we start talking about the organic life and good lifestyle, right? So let's talk about something where we know, that means how to even avoid the medicine, and that's, I guess, is a very important parameter. So today we have Dr. Ravindra, and we will be talking to him. So how are you today,
I'm
Doctor?
fine, thank you.
That's really good to know. First of all, I want to thank you very much for making time to meet us. And I must tell the audience as well, that means I have visited him several times for my own reasons as well, and he's an amazing doctor. He's very helpful. He's not one of those people who are going to try to retain the patients. He's always going to try and make sure that they don't come back. So it's just that you have to listen to him, and definitely you don't have to go back to him again and again. So, Dr. Ravindra, before we talk about everything else, can you tell us more about yourself?
First of all, thanks to invite me. And for myself, like I'm Dr. Ravindra, and I come from very small place in MP. I have done my post graduation from KJ Sumaya Sayan Hospital, and then I have started practicing in Mumbai.
Right, I understand that from that college you have done your post-graduation in dermatology, right?
Yeah, dermatology.
Right, okay.
KJ Sumaya Sayan.
Okay, alright. So what got you interested into dermatology?
Actually, when I have done my MBBS, then I thought, okay, apart from doctor line, I just want that I can give myself time also.
Okay.
So dermatology is the option where I can give time for myself also.
Right.
So in that case, then I decided to join
This particular
dermatology.
subject.
Dermatology.
Right.
So, yes.
Right. Okay. Okay. And since when are you practicing?
2007. Since 2007, I have been practicing in this area.
That's a very long time.
17, 18 years.
I don't remember. I don't know that if you remember this particular instance. Before, means I've met you now. I have met you very long time back before as well. I had gone to England, and I came back with a massive eczematic piece on my foot.
Okay.
And I had seen a doctor, and apart from the foot, it was here on the eye as well. I don't know, means if I caught an infection in England or what happened. And I had seen a doctor in England, and I had seen a doctor in Delhi as well, and spent a lot of money. And then I met you, and I don't think that I spent too much on that, but I got the results in a week's time, that the entire eczema was gone, and I was absolutely better. So what do you think makes you so different than the rest of the dermatologists?
I think it's not different. Basically, once you diagnose, the treatment is very easy. Diagnosis is the most important thing. If you diagnose the disease properly, then treatment it's literally very easy.
Right.
So diagnosis is very important. And when you diagnose something, you should know what is the reason behind the diagnosis, or what is the reason behind the disease. Suppose you are asking me the eczema, why it happens. First is genetic factor. Second, suppose I'm not saying I'm just saying general thing. If you are in the AC, then obviously eczema increases like that. So then you have to ask the history, whether you are most of the time you are in the AC, or what kind of profession you have. Then you can conclude the diagnosis easily. So that most of the time doctor just they see, start writing the medication. They don't think about the diagnosis, or what is the thought process behind the diagnosis. That is very important.
Right. We had a very long chat last time we met about, means, the kind of outfits you wear, the kind of, means, material for the outfits that you wear, and about open foot shoes and all of that. Means I understand that means I'm the last person to talk about it, because I'm always very uptight in the formal wear. But I really think that a lot of people who have option,
yes,
they should be aware of it. Can you throw some light on that as well?
See, basically, especially in India, you cannot wear tight clothing. but because of the pressure of media or whatever, most of the person wear jeans, synthetic and tight clothings, and I am totally against of that. Because see, in India temperature is 40 plus, and especially in Mumbai humidity is too much. When you wear synthetic tight clothes, obviously you get more sweating and perspiration is there, and a lot of fungal infection is there. So what is the solution? Avoid those things. Wear cotton light color loose clothes. So that I also follow, and then I tell the patient, but no one listens. So that is the thing.
So, what are the alternatives for those people that who do not have the option immediately for doing something like that?
Everyone has options. That is your choice. See, a lot of patients comes to me. They have a fungal infection, and then I tell them it's better to wear jeans. They don't wear. Why? Without jeans, I cannot go to office. Why? You can wear simple cotton trousers. They don't think jeans means pant. That is the thought process. You can wear cotton trouser, loose clothes. No, what is the problem? But no, that is the thought process. Why? Because everyone wear jeans, and in the social media everywhere jeans is, you are modern, then you have to wear jeans. No.
But apart from being modern, there is one another need of the business as well. That in what happens in your regular office, that this is the acceptable clothing. A lot of times you are on the forefront of offices, you are not even going to be taken seriously. So, right attire, which is considered to be business attire, has a certain stigma to it. So how that can ever be evolved?
Then you have to break it now. If you have a personality, you can break it. And once you break it, everyone follows that thing. So you'll be the leader in that
particular section.
Yes. Yeah, obviously you should have to have courage, and you have to have this thing, confidence, na?
Right.
Then you can break it easily, na?
Right.
It's up to you, not up to the other person.
Right.
How you tackle that situation.
Okay.
But most of them, they don't have that much courage. So that is a different story, but you can break it. See, if you wear normal trouser, no one will tell you, no, you cannot come inside. Maybe
in
first
those offices.
Yeah, that's what I'm telling you. Na? Maybe first once or twice they will tell you what kind of clothes you are wearing, but if keep on wearing those things, then they will follow you also. You see, when you are in the office, then you talk generally that I have this problem and that problem. And once you tell them, because I am wearing these loose clothes, I don't have those problems, then they will think, yes, because of this or yes.
Right.
So slowly it will take time. So you may be the pioneer of that.
Right.
You means the person,
the
be the pioneer.
the metaphorically.
Yeah.
Yes, I
So,
understand. Yeah. So when we met last time, we spoke a lot about the organic eating, and before that, I must ask you. So since when are you? Means how long it's been that you're practicing the cotton wear and open foot and all? How long it's been?
Maybe 15-20 years.
15 to 20 years.
15 to 20
Okay,
years.
so before you actually even ventured into the dermatology.
Yes.
Before that, all right.
See, when you open your mind, then you will come to know, okay, no, these are not good things.
All right.
So, whether you are a dermatologist or not, you will change it.
Right. So I would say that means you already were kind of interested in this particular section even before pursuing dermatology.
Yes.
Right?
Yes,
Okay.
yes. Because since almost 24 years, I've been going to gym regularly, irregularly, but still I'm going regularly or irregularly, whatever you say. But so then my thought process changes from eating habits to clothing habits to everything.
Right.
Whether it is right or wrong. Once you open your mind and then think, then you will come to know, no, this is not right.
Right.
You don't see that everyone is doing the thing. See, you follow your mind thought process, then you will come to know whether it is right or wrong.
Right.
So in that way, slowly I develop these things.
Wow. Okay. That is definitely inspiring. And you have a certain lifestyle when it comes to your eating habit as well. Means apart from the outlook of the comfort and what do we call it? The wellness that you have for the clothing, you also have certain eating habits that keeps you that kind of happy and satisfied inside as well. So can you tell more about it?
See, I can start from the breakfast. Most of the time, sprouts, if you know the sprouts, means all kind of grains like chana, moong dal, seng dana, soya bean and all. I mix in the night time and in the morning time. See, basically I eat those things for last maybe 20-25 years.
Mhm.
Breakfast, some amount of sprouts, some amount of dry fruits and poha or
And it's still
dosa or
vegetarian
something.
lifestyle that you have,
Yes.
right? Yeah.
That is also some scientific reason also is there and spiritual reason is also there. Everything is there behind those things.
Okay.
Okay, so this is my breakfast and lunchtime normal dal, rice, roti, sabji, whatever. And cucumber, carrot must be there. Fiber should be very important.
Right.
Okay, and dinner is also like dal rice. Most of the time dal rice. That's it. Dinner
Okay.
is also before 7:30 or something.
All right, okay. So, what do you recommend that how people can avoid those kind of skin conditions and the rest of the problems as well with the lifestyle? Like, what kind of lifestyle
See-
is apt for?
See, if you ask me, more than 90% of the problem, apart from accident and genetics, more than 90% problem occurs because of the lifestyle, food habit. These are the main reason behind the 90% diseases, apart from genetics and accidents.
Right.
Like if you don't eat properly, obviously you'll get a lot of problems. See, if you eat a lot of spicy food and oily food, you'll get acidity problem and ulcers and a lot of things. So if you don't eat those things, you will not get those problems. As I told you, more than 90% problem because of that. Suppose if you eat dinner around 10 o'clock and sleep at 11 o'clock, obviously you will get acidity problem, indigestion problem, and then cholesterol, then blood pressure and everything get it.
Right. And then you look for the medicines for those.
So prevention is better than cure. If you eat properly and healthy lifestyle and food habit, you won't get those problems.
Why I feel that you're the only doctor who are telling patients how to not to come to them.
Yeah, even yesterday one patient had come to me, he had a fungal infection and he was wearing again synthetic clothes.
Okay.
So I told him, whether you stop wearing synthetic and tight clothing, so you won't have to come to me. If you don't follow my instruction, it is better for me. You will keep on coming to me. So choice is yours. The decision is yours, whether you want to come to me or whether you don't want to come to
Don't
me.
do it.
It's totally up to you.
Absolutely.
That way.
So, you changed my perspective of eating in olive oil because you were asking me at that time. And you had a thought process that since olive plants are not indigenous to India,
Yes.
and this is a concept which is coming from the Western culture. And this is why we think that it is expensive and it is good, and how the other oils are good. I did my own research. I'm going to be very honest.
Yeah,
I just
obviously
do not.
You should do it.
Yeah, so
See,
I
what
haven't-
I'm saying, you should not follow blindly.
No,
You
it's
should,
not only you. In general, I research a
general
lot.
also, no? So, if somebody says something, you just listen and then you do your research, and when you conclude, yes, this is right, then obviously then you will follow that.
Right, right. And you also spoke about a couple of other fruits as well, which are not indigenous to us, but we are eating it because it's expensive, because it's promoted in a certain way. Can you tell more about that? Means specifically people in India, in different regions, what should be the right way of eating when it comes to a healthy lifestyle?
So that is what, again, it's a thought process. Na? Everyone thinks expensive means good.
Yeah.
See, if you eat local fruits, you feel it's very cheap. There must be no nutrition, nothing is there. But when you check on the Google or whatever books, then you will come to know, no, these are the very nutritious food. And especially apart from the local fruit, you have to eat season-wise fruit.
Right.
Suppose in summer season, watermelon and muskmelon comes, so you have to eat those things. Not eat those things when it comes in the winter season, but because of the cold storage, you can eat in the summer. No, that is also not good.
Right, right.
So according to the season also, you have to change your fruits and even eating habits also.
Right.
See, in the summer season, you should eat light. In the winter season, not in the Mumbai. Suppose you stay in the north side of India,
Right.
where the temperature is too less in the winter season. Then you can eat lot of oily stuff because there your BMR increases.
Right.
So
Right.
you can afford to eat those things. But
Okay.
if you are in the summer, like in the Mumbai area, where the temperature is almost same all over, then you should eat light food. So according to the where you stay, accordingly also you have to eat.
Your body will adapt to the climatical condition more than the your lifetime food habits. So wherever you are, wherever you stay, that will
Accordingly,
be,
then according to the season also you have to change your food habits.
okay.
Everything you have to change accordingly. As I told you, in the India you should wear cotton and loose clothes.
Nice.
In the Western, you can wear trouser. I mean to say tight clothing and suit and everything.
Right.
In India, shirt and pant is more than. Ideally, you should wear dhoti kurta, but that is not possible now. But that is actually ideal
Uh-huh.
in the Indian weather.
I'm going to be honest with you. So I had this instance that I was wearing sari for the first time in a conference. Not like sari for the first time, but I was wearing a cotton sari for the first time. And everyone who's are behind the cameras right now, they can witness actually how many times I had said it, that this is so comfortable. That
Yes,
I'm
it is
literally getting
actually.
used to it.
Yes.
That was the impact of your speech on me, by the way.
Mhm.
That I was wearing the cotton sari for the whole day. But I never thought it to be so comfortable, and yet at the same time, it was looking very formal also.
Yes.
And
You look very different, elegant.
yeah, right.
No doubt about it.
Right. So it was very easy for me to move around, do my work, and do my chores, and be on the stage, down, up and down, and all that. So it was not very difficult, and it was easily managed. Because I don't think that I'm the kind of person who can manage sari, but cotton is very easily managed.
Once you start wearing it, then you will come to know. See, you means not you. Basically, suppose if some person wears tight clothing all the time,
Mhm.
once he start wearing loose clothing, then he'll come to know, he or she will come to know, yes, that is more, this is more comfortable. What you used to wear, like tight clothing and tight skin fit jeans, that is not, ideally it's not good.
Right. Right.
Then you will come to know,
Right.
yes, these are the things you should wear.
Right. Right. So we had also spoken about a concept that you gave me at that time. That if you can enlighten our audience as well about it, it was something to do with where you mentioned that means what kind of elements you're made up of, and the plants around you are made up of the same kind of elements, right? And if you are born in a different area, then the elements around you, the plants around you, are also made up of those particular material. So this is why the indigenous plants are better for you and the outside plants are not. So can you shed some more light on that particular talk?
Same concept, like if you stay in India, the nearby area, whatever the grows, like if you know the bear
I know.
means-
I read about Veed, in fact. Means when you said it, I read about it, and it was telling me, it gave me an article how it is like means 10 times better than an apple. But just because there is an English saying, an apple a day keeps the doctor away.
That is
so
the
somehow
English saying.
Apple got famous, and Veed was.
So
kind
that
of
is what I am
blind.
saying. That is the English saying from Western world,
Yes, correct.
not from the India.
Correct.
So
Veed
beer
is 10
is
times.
very
Yeah.
and beer is very cheap. Then you
Right.
will not eat
Right.
because it's a Indian food and local food. You will not eat,
Mhm.
and you think there must be no nutrition, nothing, but it has a lot of fiber and everything. So
Right.
that is good. That the same concept is again where you stay nearby, whatever grows, you should eat that. According to the weather, you have to eat. According to the weather, you have to change your lifestyle and everything.
Right.
But we blindly follow the Western culture. Why? Because they earn lots, so they think. I mean to say, we think what they are doing is best.
Right.
They are doing best in the business,
Right.
not other things.
Right.
So those are the things.
Also, I guess there is another problem to that as well. Apart from the fact that some people are submitting to the fact that they are doing better, so this is why we should follow it. The research and studies are more done on the fruits and plants there. Don't you think that we are somewhere lagging behind to to spread the word that what is better, what is not? If this kind of information is public, I don't think that anyone will be resorting to apple more than the babe. So most people don't know about it. What about the awareness?
So basically, it's because of the research paper. In India, I think we have been doing all this thing from last thousands of years, but we
Right.
don't make papers.
Right about
We verbally we say, see, if I have my daughter, If I tell her, okay, these things are good, these things are bad, we are not making papers.
Right.
And Western people, they start making notes,
Document everything.
documentation of everything. That is the reason behind what we think. Okay, they have documented, it means that is right. We didn't document doesn't mean it's not good.
Right.
So that is the only leaking factor.
Right. That actually does make a lot of sense.
Because verbally we used to do everything verbally, na?
Right. Right.
So that is the problem. That is not actually problem, but nowadays, if it is on paper, we think it is good. If it is not in paper, no, there is no scientific proof. Who makes paper? Person makes paper.
Right.
You can influence that person also.
Right.
He or she can make wrong paper also.
Right. Makes sense. What is your opinion? Means, what is the alternative that you can share with the audience for the exotic fruits? That means exotic fruits like maybe strawberries and kiwi and all of those things. So what are the indigenous fruits of India that are replacing those exotic fruits in terms of the benefits?
See, then again you have to do some research from your side.
Right.
Like as I said, pear,
Right.
even banana also, or whatever the fruit from local area. You have to research on Google or something. What elements are there in that and what nutrient factors are there in that, and accordingly you have to adopt those things. You have to eat those things.
Right. Do you mean to say that it depends on person to person, that what kind of vitamins are low, and based on that, what is the replacement fruit for that, which is Indian origin?
Yes. Then you have to do your search.
Yeah.
You have to do your research, and then accordingly you should start. If you ask me the thumb rule, you have to eat local fruits. That's it. Better close. I mean, it was a thumb rule.
Right.
You
Something
don't have to
that's
research
brought
everything.
into-
You don't have to
Yeah.
research everything.
Right.
You just follow. You just start eating local fruits.
Right.
That's it. And seasonal fruit.
Right.
See, some fruits come. Apple comes 12 months in a year.
Right.
So you should not. I mean, to say you can eat, but you should prefer eating seasonal fruit.
Okay.
And you should eat whole fruit instead of whole fruit. Lot of person want to drink the fruit of that, the juice of that.
Yes.
Juice
right.
is, see, if you ask me, juice or whole fruit is much better than juice.
Juices. Okay.
Because see, they remove fiber and a lot of things. Pulp, they remove pulp also. No? The pulp also has a nutrition. No? So it's better to eat entire fruit instead of making
Having
juice.
Okay, that does make sense. Alright, so means that actually kind of opens up the eyes a lot about the condiments of the food, because that is, I would have totally forgotten this particular question. I really want this to be reaching the audience as well. About the condiments that you have for the food that you make at home. What kind of are there any ingredients that you avoid in it? Means maybe ginger or garlic, or means any certain things that people normally put those condiments in the Indian making, but you avoid it.
See, if you have heard about the sattvic food and tamasic food.
I've heard, but I'm not very familiar.
Okay.
I'll be very honest.
So tamasic food means, like, suppose if you put lot of this onion, garlic, this comes in the tamasic food. When you eat those kind of tamasic food,
Is it good or bad thing?
it depends upon your lifestyle.
Okay.
Like if you are a very hard working person and all this thing, you can digest those things.
Alright.
If you have a sedentary lifestyle or something, it is better to eat sattvic
okay.
food.
Makes
According to your
sense.
lifestyle, see, veg and non-veg again. Non-veg good also, bad also. It depends upon your lifestyle. If you do very hard working job like labor class or something, for them non-veg is okay.
Right.
If our kind of person like you and me, most of the time
No, I work out a lot.
No, you means in general term I'm saying
Right.
means if you don't work hard, then you require sattvic food. You should not eat non-veg, because to digest non-veg at least 4-5 hours requires,
Right.
and for that you should
You
have
don't
to
have the
lot-
complementing workout, you do not have the complementing effort that you have to put to digest that food.
Yes.
And just sitting your stomach down is not going to do anything good for.
So according to your lifestyle and all this thing, you have to decide your food also. So sattvic food is better if you have a sedentary lifestyle or less
Let's move around.
less move around.
Right.
And suppose if you eat a lot of garlic and all, your nerve stimulation system, nervous system also stimulates a lot.
Right.
So if you want your mind should be cool and calm, then you have to eat sattvic food.
All right. All right.
Lot of things.
But that makes a lot of sense, that because there are different videos which are sometimes people promote ginger and garlic, sometimes people are anti, but now that makes more sense to me, that it is more to do with what kind of lifestyle you have, that are you in the ability to actually have that in your diet plan or not.
What you can digest or not, that is
Yes.
also a very important. No?
Yes.
And the amount of garlic, you may require this much, like 1 gram or 2 gram of garlic, and you eat 10 grams of garlic, then what will happen? It is good to eat more. No?
Right.
Then it will become poison for you.
Absolutely.
So it
That
depends
makes sense.
totally. It's a lot of moving factors are there. Your lifestyle, food habit, your genetics, and then how much amount you are eating. You are eating in the morning time, lunch time, or dinner time. That is also important. Suppose dinner should be very light, breakfast should also be light, but lunch you can have heavy lunch.
Right.
But
You
dinner
have
should
the whole
be
day
yes.
too. Right.
And in the breakfast you have to have a lot of fibers in your breakfast.
Right.
Lunchtime, okay, you can still
Well
manage.
down, yeah.
Yes, but dinner time also it should be very light.
Right.
So lot of factors are there. Now then you have to work accordingly.
Right.
So again you have to open your mind, think what you are and what is your lifestyle. Accordingly you have to eat food. Not everyone is eating pizza, so you should also eat pizza. No.
Right.
According to you.
And how long it's been that you have eaten outside food?
See, dal rice, so I eat most outside in the dinner, in the dinner time. But dal rice is the only thing, or chapati, dal, I can eat outside. The rest of the thing I don't eat outside.
All right. Okay. So you.
So that is also chapati is also without ghee.
no
without
like
ghee.
Charora's street side food or
No.
is none of those ever
I
you've
think
done?
more than 15-20 years.
15 to 20 years ago. That is definitely a life goal. And one important question that just came to my mind now. What is your opinion about those diet plan for losing weight that cuts off certain vitamins from you? Like means I don't want to name a couple of diets, but means for
I
example,
don't think
if you say keto, it cuts down on the carb, and there are certain different diet plan that cuts off one particular nutrition completely.
Very
So-
bad, very bad, very bad.
Isn't it?
Literally very bad.
Right.
Because I have seen a lot of patients, they come to me for the hair fall problem. Why? What was the reason behind it? Because they have done a lot of this again, the
Diet.
keto diet or something, and suddenly they change their diet and then now start losing hair like anything. Why? Because see, you are eating everything. Your body used to
Has
have
to be in right
everything.
portions.
Yeah.
Yeah.
Once you cut off suddenly, then
Yeah.
your body cannot tolerate that much. Na? Suddenly you stop everything and then you are eating small amount.
Not a good style.
Yes.
lifestyle.
And if you want to change your diet and everything, it should be slow process.
Right.
It should not be sudden.
Right.
Then you got the problem.
Right.
So instead of sudden stop off everything, slow taper it down. Like suppose if you are eating that much amount of money, then amount of food, then slowly you have to reduce the amount of food.
Right.
Don't stop everything together.
Right.
Even once we start the medication for the hair fall for like suppose 6 to 8 months, normally a patient stop coming after 6 months. They stop everything altogether. Then again they start having hair fall problem, and then after 2-3 months they comes to us, doctor, I start getting hair fall again. And I told him or her, why stopped everything together? Because I have been giving you multivitamin, antioxidant, protein powder and everything, and you stop suddenly and your body reacts again.
Right.
You have to stop, taper it out also slowly.
Then the problem comes back also quick when you
Yes.
start having it again. So
Yes.
doesn't really make sense.
Slowly, yes, everything should be slow.
Transition.
Yeah.
Yeah, means I just met my dog's doctor, Dr. Dave. He is in Borivali. Well, last weekend, and he was just telling us that okay, we have to change his food because this food is going to stop. Marley, my dog, he's on a special food
Mhm.
because he has pancreatic insufficiency. So he has
Indigestion,
yes,
basically,
so he
indigestion.
cannot digest fats or anything which is heavy. So his pancreas have totally failed.
Mhm.
So he has to be on special diet and special medicine all the time. So he was like, that means this particular food is going to stop. In maybe you have 2 packets, that's a good thing. But buy the other food also, which is this, or this. And you need to buy it now so that you can slowly mix
Slowly,
it.
yes.
Then dhire you have to remove
Yes,
that
yes.
other food from
Yes,
his
yes,
life.
yes.
And I was like, I did not ask him why, but now
You got
since
my
you
point
said
now?
it, yeah, now I can understand why was he telling me to transition. like
Suddenly
this.
you should not stop everything.
Right.
If you want to,
properly.
if you want to change your lifestyle or whatever, it should be slow process.
Transition. Absolutely wonderful. Right. Thank you very much. But now to close our conversation, one important part for all our listeners and viewers and the audience, what kind of things, any advice for them that can convert the potential patients into healthy beings?
Prevention is better than cure. See, you should open your mind and see. Most of the listener over this channel, they must be educated, or whether you are educated or not, you should have to have a brain and it should be open. And you think about this. Okay, whether you are doing right way or you are doing wrong way. See, you should not follow blindly what everyone is doing.
Right.
That is the most important thing. See, I'll tell you one thing. Everyone should not be, everyone will not be correct.
Correct.
If everyone is eating cold drink, it doesn't mean it is the right.
Right.
So you open your mind, think, and then accordingly you act.
Right.
That is the thing. So again, the prevention is better than cure.
Right.
That is the main
Thank
concept
you.
behind it.
Thank you very much, Dr.
Thanks.
Ravindra. So here today we have a talk with Dr. Ravindra, and we learned one thing for sure, that apple is not the only thing that will keep the doctor away. There is a lot of lifestyle changes you have to bring. It starts with what you eat, what is inside your body, and it goes to what you wear outside, exterior as well. That is going to play a very big role, not only in your skin and the glow, but it is also going to make a difference in overall lifestyle as well. So learn more how everything is connected, and you can drop your questions at the bottom. We'll see you in the next week. Thank you.